My name is Becky, and I have an 18-year-old son that just went through the PRC, or Pain Rehabilitation Center. His name is Nick. He is a senior in high school this year, and this has been an amazing 3-week experience at Mayo. He has a genetic disorder where he has constant bone and joint pain since birth. So he was leading a pretty normal life after we got through all of the fractures. And the year before his sudden onset, he was swimming competitively, great friends, going to high school. He had swam in a swim meet this one weekend, and the next Monday he had a sudden onset where he had debilitating episodes where he would just go limp. None of his motor skills would work. He couldn't talk. His speech was slurred. So September 26th, we ended up in the emergency room. After that, we saw numerous specialists, different doctors. They poked and prodded and tested him for 4 months out in California, where we're from. And doctors didn't know. The doctors would tell him it was all in his head because they couldn't figure out what was causing his body to have such violent episodes. And it's really scary to have, your son, who is this amazing, competitive swimmer, athlete, 17-year-old normal kid, go from 165 pounds in September to 130 pounds in December. No answers. When we arrived at Mayo Clinic on January 25th, Nick was in a wheelchair. He was bundled up with a scarf and a hat and mittens and coats and layers of shirts and a blanket, and not able to walk on his own steam because he had such chronic fatigue, and these episodes were happening that we were afraid he would fall and hurt himself. We had an appointment with Dr. Fisher. Within the first 5 minutes, he diagnosed my son. He said, "I think that you have autonomic dysfunction and this, syndrome called POTS." Then another week followed of tests and consults with other specialists here at Mayo, and basically they confirmed that Dr. Fisher was 100% accurate. That's what was going on with Nick. And amazingly enough, Mayo Clinic has this pain rehabilitation center that actually treats kids with POTS and autonomic dysfunction and things like that. And then to see him in this program, not even 3 weeks later, doing physical therapy, occupational therapy, recreation therapy, all the different components. Last Saturday, he was climbing a 60-foot rock wall and swimming at the YMCA with the other kids. He's back in the pool. Monday, he will be back at school full-time. He has not attended school since September 26th. He will be back in the pool, swimming in a swim meet next Thursday. The program at the Pain Rehabilitation Clinic is not only for kids, but it's for the parents. The kids have 40 hours a week that they're here doing intensive stuff to get better. The parents are here about 20 hours a week. I think that the program is so successful because the kids are so close and they form this incredible bond, and it's the same with the parents. I don't think without the support of the other parents that I could have done the work that I needed to do to support him in his recovery, in getting him back to his everyday life. In the program, Dr. Bruce talks about parents, and she says there's a continuum. On one end is the pillow fluffer. That's me. You've heard of the helicopter moms? Well, I'm the queen helicopter, and I've always done that. That's been my job. I'm the hoverer. And then on the other end, it's punitive, where it's like you get so frustrated after your kid's been sick for so long. It's like, come on, tough it out, get up, you can do it, the doctor says it's all in your head, just come on. And so parents often go from one side to the other or back and forth, because if you're being punitive, then you feel guilty and you're like, oh my gosh, so then you're over here fluffing the pillow again. And so what you want to do is be able to get right in the center, which is warm and firm, but neutral. So if your kid is exhibiting pain behaviors, you're not encouraging them and enabling them, but you're not punishing them either. You're just in the very neutral spot. And it's hard to learn. I mean, you're so exhausted and you're so tired of talking about it and trying to explain all the symptoms and everything that's going on. By the time you get here, I was a ball of mush. And so to have the parents that had already been here a couple weeks there to support me and say, I know you're in a tough spot right now, but if you work the program, if you listen to the doctors, listen to Dr. Bruce, be that warm, neutral, it'll work. And it did. I mean, I can now say it worked. We call Mayo Clinic the Mayo Miracle, because everyone that we've seen, the nurses, the lab techs, the people that take blood, the people that do the tests, everybody, OT, PT, the people in the business office, every person that we've met here has been incredibly warm, caring, supportive, nice, positive. It's like Mayo creates its own universe, and when you're here, you just feel like so uplifted. We have video of him scaling a 60-foot wall in 3 weeks. I mean, so how miraculous is that? So it's been an amazing transformation from start to finish. And now with him able to get on with his life, go to college, he can succeed at anything that he puts his mind to. And it's huge. It's miraculous. I mean, I keep saying that word, but I can't think of another word to describe it. It's just so wonderful that Mayo has given him his life back, given me my son back.